Hello everyone, I am Lance Wilkerson at Deaconess Hospital with OBGYN Dr. Sarah Onan, and we're talking cervical cancer in this video. So talk about cervical cancer and how that is diagnosed.
Yeah, so cervical cancer would be a tumor, or sometimes we find, precancerous lesions of just the cervix. So some people get a little confused about what the cervix is. It's the lower part of the uterus. And so cervical cancer is much different than uterine cancer, much different than ovarian cancer of the ovaries. So it would be cancer of the lower part. And it's typically diagnosed by your routine screening. So we would find it on a pap smear when you come in for your annual exam.
Is it more common or less common than the other two that you mentioned, or is it about the same?
I would say it is becoming less common now that we have vaccines, but probably worldwide it's the more common of them, yeah.
So if someone unfortunately gets that diagnosis, what are some of the treatment options?
Yeah, so if you get a cervical cancer diagnosis, you would typically be referred to a specialist called a gynecologic oncologist, and that's a doctor that specializes in only cancers of your reproductive tract. And they would typically talk to you about surgery, possible radiation, possible chemotherapy. But when you see me for your annual exam for pap smears, there's a good chance that we will catch a precancerous lesion. And then there are other treatment options for that. So if we find it early, we can do more outpatient procedures like a LEEP, where we just remove a small piece of the cervix. Or sometimes there's techniques to burn the cervix or freeze the cervix. So depending on where you are, when we find the precancer or cancer would depend on your treatment.
And you talked about the vaccines. Talk about the role that HPV plays and
Yeah.
the importance of getting a vaccine.
Sure. So cervical cancer, about 99% of cervical cancers are caused by the HPV virus. So HPV is a virus that spreads sexually. It's the most common sexually transmitted infection. And it's about 80% of women will be exposed to it at some point in their lives. So to get the vaccine, we know that the vaccine will prevent some of the most common types that cause cancer. So it is the best tool we have to help prevent cervical cancer.
And finally, obviously early detection is key. You discussed that. So some people put off their annual exam more than the doctors would like. Talk about the importance of making sure to do that every time to be able to catch these.
Yeah, so coming in every year allows us to screen you for any signs or symptoms of cervical cancer and do your pap smear. Cervical cancer is typically a slower growing cancer, so if you come in, we have time to catch it early and hopefully treat it before it gets too advanced. And then we can also talk about getting your vaccine if you're eligible to help prevent any other of the subtypes of HPV that could cause genital warts or other things of that nature. And make sure that you're not smoking. That's the other way that we could maybe help you prevent cervical cancer. And just talking about your general female health.
All right. Well, thank you so much, Dr. Onan. And Dr. Sarah Onan is accepting new patients. You can go to the website on the screen, deaconess.com/findadoc, and put her name in there, or call the phone number on your screen. Well, thanks so much, Dr. Onan. Appreciate it.
Of course.
Thank you so much for watching, and have a great rest of your day.